Assalamualaikum. So today we will talk about chapter 6, interpretation of clinical exercise test data. So in this chapter, what we will learn is about we will learn how to interpret the data that we have collected. So the first part in this chapter being the Bayes theorem. He said that the poster's probability of having disease is determined by the disease probability before the test and probability that the test will provide the true result. Means that you cannot conclude that someone have this kind of disease by only seeing his sign and symptoms. The probability that he will get the disease is still high. And the second one being the probability of a patient having disease before the test is related. Most importantly, the presence of symptoms, but also the patient age and gender, but the presence of major risk factor for cardiovascular disease. Means that when you clear up the patient that have and say that they have no disease, the patient still can get the disease before the test and after the test. It means that while the test is ongoing, the disease is not there, but when they are home, the disease came. So that's what Bayes theorem trying to say. So next one being exercise testing as a screening tool for coronary artery disease. When we talk about coronary artery disease, we talk about typical or definite angina and atypical angina. So when we talk about angina, it's a chest pain. It's an subternal chest discomfort that may radiate the back, jaw or arms. And typical angina is a chest discomfort that lacks one of the mentioned characteristic of typical angina. So basically, typical angina is a chest pain consists of subternal chest pain or discomfort that is provoked by exertion of or emotional stress, relief by rest or nitroglycerin. But a typical angina chest pain applies when the 2 out of 3 criteria of angina are present. So it means that when we want to talk about typical angina, there must be 3 things. But when there is a typical, there only needs 2 things out of 3 from the typical. The next one is what we are trying to interpret. Of course, the heart rate response and the blood pressure response. The last one being the electrocardiograph waveforms.